into our head box here, okay? And then we do have an amplifier cable that runs from our head box to our amplifier here. And then this is how much slack the patient has to move about the room, okay? Ideally, they would be in bed a lot of the times, but little ones are going to be running around the room quite a bit, so that's totally fine. We would have them place the head box then in this knapsack or backpack, and then this could go around their arms and then just get snug in like this. We will look into exploring the backpack option too in case this doesn't work out. Okay, so then with this secured, then they can move about the room. This is the camera piece here. It's a 360-degree camera, so it does rotate all the way around. The monitoring service Care would be the ones then to manipulate the camera to follow the patient as they're moving around the room. Okay, so the setup idea is that we would come in the day of the hookup. The technologist would get the machine set up and the electrodes applied to the patient. We would touch base with you, the nurse, to make sure you're comfortable with the recording and the placement of the machine. I'm guessing it's probably going to go over there so we get a wide view of the room. And then from there, we would have Care log in and monitor the patient 24/7. Okay. Now they'll call you if they see any issues with the electrodes or if there's any events with the patient. They'll also contact you as well to let you know that. And then they will be able to manipulate the camera to follow the patient around, so you guys won't have to worry about moving this machine around all the time to make sure that the patient's on video. Okay. All right, so patients in their room, they've got the electrodes applied, everything's going swell. We're going to be wrapping the head with gauze as well to try to protect the wires as much as we can. The recording will be on typically for 24 to 48 hours. In that time frame, the glue is typically pretty stable. Okay, these are hard to get off. You really have to pick at them or pull at them to remove them. They're a little bit more secure on Sammy than they would be on a regular human being, just because there's no natural wings in Sammy's plastic skin here. So on a regular person, there is a little bit of slippage with the glue, but again, it typically is pretty secure for that time frame. Okay, when you start getting up to the 4-day or 5-day mark, the gauze starts to get pretty loose, and then we just have to come and reapply. But most of these recordings will just be the shorter ones. Okay. So once they're on, they're pretty secure. You have to pick at them quite a bit to get them loose. The electrodes themselves are plugged into a harness system right here, and then that's attached to the head box. So this harness system can actually be unplugged like this, and then these wire bundles would stay on the patient's head, and then this can be disconnected in case the patient needs to leave the room for any reason. Okay, so if they have to leave for an MRI or CT or just out of the room for a different procedure, you can disconnect the electrode bundles through this little clip on the head, and then they can leave the room as well. Okay, but for the most part, they'll be plugged in pretty much all the time.